Hello there. If you're someone that has tried the low FODMAP diet and you didn't quite achieve the results that you were hoping for, or if you've looked at the low FODMAP diet, it's totally overwhelming and you're not sure if it's something that you actually want to do, or you've simply heard the hype around gut-directed hypnotherapy, then this training is going to be absolutely perfect for you. I am so excited to have a special guest on today's training to talk all things gut-directed hypnotherapy for IBS management. Her name is Dr. Simone Peters, and she is a clinical gut-directed hypnotherapist that has been in the gastroenterology space for the last 10 years. So please bear with me as you come in. I'm going to invite Simone on today's live, and I'm also going to turn off the comments. I have so many questions that I want to ask Simone. I really want to honor her time, make sure that we can get through all of those, which I know are going to be really beneficial for you as well. And then if we have time at the end, I'm going to open up the questions. So please settle in, grab a pen and paper. It's going to be so valuable. Good morning, Simone. How are you?
Hello. Hi. I'm well. How are you?
Excellent. I'm doing well. Thank you so much. Thank you for joining me on this live session. I've already given the audience a brief introduction of yourself as a clinical gut-directed hypnotherapist that's been in the gastroenterology space for the last 10 years. For my audience that don't know you so well, I would love for you to be able to introduce yourself and give them a little bit more information on you and your history.
Okay, sure. So my name is Dr. Simone Peters. I am as you say, clinical gut-directed hypnotherapist with a background in psychology. I am the founder and owner of a clinic called the Mind and Gut Clinic here in Melbourne, Australia. And I am the sole content creator for Nerva, the gut-directed hypnotherapy app, which we're going to be talking a little bit about today. I guess in terms of my background, you're right, I've been married to gastroenterology, I think, for over 10 years now. And I originally became interested in this space because I was quite aware of the interactions, I suppose, between our mental state and our physical state in the context of the role that different psychological therapies might be able to play in the control of gut-related symptoms. And I was very fortunate to join Monash University to do my PhD. And it was in fact on a completely unrelated topic to what we're discussing now, but on gluten and the different proteins in gluten and an entity of people that we call non-celiac gluten sensitive individuals. But that's a completely other story. But somewhere along the line, my PhD became hijacked by hypnotherapy, and we started to do some trials in this space. And I guess since then, we've become a little bit obsessed with the use of hypnotherapy in our sort of IBS or our functional gut population. And so I have stayed with Monash University after finishing my PhD and hold a research position with them as well. And was involved in the setup of what is actually still now the hypnotherapy program that's run in a tertiary hospital setting here in Melbourne, the Alfred Hospital or Alfred Health. But unfortunately, due to time commitments, I'm no longer with Alfred Health, but I do keep my finger on the pulse in terms of what's going on over there from time to time. So I guess that pretty much sums up me.
Excellent. Thank you so much. And hearing you talk about how your work has evolved over the last few years is really exciting, because what a great time to get into, I guess, the gut health space, learning about gluten intolerance and there's non-celiac gluten sensitive people, but then to get into this gut-directed hypnotherapy space where you've done so much wonderful research, and I've read a lot of your papers, and I'd love to talk about a little bit about the research that you've done. But can we just start off and talk about what is gut-directed hypnotherapy? Because a lot of my clients will raise an eyebrow when I bring it up to them. I think it's probably because of what we see on TV and in movies, and I would love you to explain what it actually looks like in a clinical setting, and as well as how it's delivered through Nerva.
Okay, sure. So you're right. I think that there's a high level of skepticism that exists around the use of gut-directed hypnotherapy, but equally, you're right. I think with a little bit more understanding, people are pretty open to the idea when they understand what it is. So I suppose in terms of describing what gut-directed hypnotherapy is, first we kind of need to look at what hypnotherapy is. And I think the best way of describing what hypnotherapy is that it is very similar to guided meditation in the context that we try and get patients to relax as much as absolutely possible. And we've got lots of different strategies that we can use to achieve that. An example of that might be that we get them to do a progressive muscular relaxation. So we get them to try and relax their body from sort of the top of their head to the tips of their toes. And then once they're in that really nice, comfortable state, we provide different metaphors. And obviously the metaphors help with that ability to visualize things in a really productive way. And then in that really heightened state of visualization, we provide suggestions. And obviously the suggestions are targeted toward what it is that we're trying to improve. Now, in the context of gut-directed hypnotherapy, obviously what we're trying to manage are these physical symptoms that patients present with. So an example of a metaphor in gut-directed hypnotherapy might be that we would get the patient to visualize that their tummy was similar to a river, as an example, and we would try and get them to manipulate the flow of that river in order to improve the symptoms that they describe. So an example of that might be that a patient who has diarrhea, predominant irritable bowel, might like to slow down the flow of that river. And obviously suggestions are given while they're in that sort of deep meditative state for that control and normalization of gut function. So it's that specific suggestion that makes it gut-directed hypnotherapy or hypnotherapy as opposed to just meditation on its own. And I guess the way that we deliver that through NERVA is that we are able really successfully to be able to deliver hypnotherapy in a way that is kind of per protocol, in the context that it's exactly the same regardless of the symptom profile that the patient is sitting with in front of us. And we can deliver it in a really meaningful way so that they would experience something very similar to what they would have if they were coming to face-to-face sessions. For example, they follow a sort of a 6-week, they do with NERVA, they follow a sort of a 6-week period or a 6-week treatment with daily gut-directed hypnotherapy sessions and really large amounts of educational material around what irritable bowel syndrome is, the role of this connection between the brain and the gut, or what we call the gut-brain axis, and lots of other really important things that we would want to teach our patients in a one-on-one session. But obviously we've had to become quite savvy in terms of delivering that in a fun but yet educational way, so that people can be aware, I suppose, of how all of this has an impact on their overall control of their symptoms. And of course the hypnotherapy component is delivered that way as well.
Excellent. Thank you so much for explaining hypnotherapy as a whole, gut-directed hypnotherapy, as well as how NERVA delivers it. I especially love that there's really the two components to NERVA, where it does have the guided recordings. That's that meditation part where you've got the gut-directed hypnotherapy delivered. But I also love that they couple it with that education and the reading that you can complete on a daily basis. You tick it off, and then that is your session complete, which is so awesome. I've got a question around the level of meditation, and I think that's where some skepticism comes from as well. People think that you're going to be in a trance. Can you explain, I guess, the different levels briefly of relaxation and where you want to be if you're going to successfully implement the gut-directed hypnotherapy?
Sure. So you're absolutely right. There's varying levels of depth of hypnosis. So the lightest example would be somebody being in a daydreaming state. Now, I've never met anybody that doesn't experience daydreaming. So I think everybody can be hypnotized in a sense, because everybody can experience that sort of that daydreaming state, or that very light hypnotic state. But you're right, the opposite end of the spectrum is when somebody is in such a deep state of hypnosis that they can't actually consciously recall what has happened throughout the session. And so one's hypnotic susceptibility will dictate how deep they go, if that makes sense. Now, we know that only a very small percentage of the population, so about 15% of the population, will get to that level of depth whereby they have no conscious recollection of what's gone on around them at all. So it's the minority. And that's what we're exposed to on the TV and in the movies, is that sort of that minority response. But interestingly, we've done a lot of research on this, and we've looked at lots of different predictors of response. And one of those we've looked at is exactly this idea around hypnotic susceptibility in terms of the depth that it is achieved and what that means in terms of the outcome of the therapy. And what we've found is that it makes absolutely no difference at all. So those people who go in the lightest daydreaming state and remember absolutely everything are just as likely to improve as the people who go into the deepest possible state and can't remember anything. So I always tell my patients, what I want is for you to feel really comfortable and relaxed, like what you would if you were sitting watching telly of an evening on the couch. Anything more than that is a bonus, but we don't need anything more than that in order for it to be effective.
Excellent. I think that really helps to break down a barrier with my clients as well, when they understand that they don't need to be in that total level or that deep trance where they don't remember anything. They can put themselves into a quiet, comfortable environment. As long as they do feel relaxed throughout, they are going to get the benefit from the program or gut-directed hypnotherapy. I would love to ask you a simple question that relates to some of the trials you've done, and I've heard you answer this before, and I can't wait for you to answer it for the audience as well. Does gut-directed hypnotherapy work?
It most definitely works. I don't think I would have a job if it didn't work. We would have aborted mission a long time ago. No, you're right. There's been lots of work that's been done all around the world. So when I started doing my PhD, the majority of work was being done out of a group in the UK, so the South Manchester Functional Gut Service, which is headed by a gentleman named Professor Peter Warble. And he was sort of the pioneer, I suppose, of gut-directed hypnotherapy. And their research showed that it had really great benefits in terms of reducing these physical symptoms associated with irritable bowel. Now, of course, we're always really supportive of all research groups across the world, but I suppose when all of the research is coming out of one centre, we sort of thought, well, maybe we'll do a trial as well and see how our results compare to that of the group in the UK. But also, when you do psychological-based studies, it's really, really challenging to design a study with an adequate placebo control. And so what we wanted to try and do was to compare hypnotherapy to that of something that we use all of the time, that we can quite easily compare appropriately to a placebo, and that was the low FODMAP diet. And of course, you know, I was at this point married to Monash University, and we're all very FODMAP obsessed, and so we designed this trial where we compared the efficacy of gut-directed hypnotherapy to the low FODMAP diet. And essentially what we found was that around 70 to 75% of people responded to this as a treatment. So that's the first really important consideration, is that, you know, how many people does this work in to begin with? And then of those people who respond, we see about 70-75% reduction in their global gut symptoms. So these are really huge statistics, more than any drug we could offer any patient, and on par with what we would expect with a low FODMAP diet. Most importantly, these improvements, however, are maintained in the long term. So lots of people say, oh, that's really great that hypnotherapy works, but how do you know that it's not just a really good placebo? And I suppose the way that we can answer that question is that we need to firstly see that people respond, but then we need to make sure that they maintain those improvements. And so we at Monash University looked at people's maintenance of effect out to 6 months, but other groups across the world have done this right out to 5 years, and we've shown that people maintain those effects. So we know it's not just a time-consuming and expensive placebo, but actually people who do respond maintain those effects. We know that it works in men just as well as women. We know that there's no predictors in terms of who is likely to respond with regard to what sort of bowel habit subtype they have, or how long they've had symptoms for, or how old or how young they are. And so it really comes down to us having a firm understanding that about 70-75% of people will respond. And of those people who respond, we see about a 70-75% reduction in their symptoms.
That's excellent. It's really encouraging for people that do want to dip their toe into hypnotherapy if they have tried the low FODMAP diet before and, you know, they're not sure if doing something completely different like the psychological treatment is going to work for them. So thank you so much for sharing that with us. Something else that I found really interesting was that looking at data after people had finished a hypnotherapy program, if they had done gut-directed hypnotherapy, I think exclusively, and please correct me if I'm wrong, they even had better psychological outcomes moving forward, which you didn't get with the low FODMAP diet, which makes perfect sense to me. So certainly something to consider if you do also have anxiety or depression, which a lot of clients that struggle with IBS do have. I would love to ask a question around implementing gut-directed hypnotherapy. You said it can work for everyone. Is there a right time of day or a right environment that you should be in to get the most out of a gut-directed hypnotherapy program?
So the first part of that, you're absolutely right. There was an additive effect of the gut-directed hypnotherapy in the context that people saw these improvements in their psychological symptoms. In fact, that was the original title of the paper when it was in draft form, but we thought that might have been a little cheeky to try and push it across publications selling hypnotherapy is better than the low FODMAP diet. So there were a few revisions that took place there. But no, you're right. Those patients who did do the hypnotherapy had better outcomes in terms of their psychological state. And what I didn't mention was there was no additive effect. So people who did both things at the same time didn't do better than those who did one or the other. Now, in saying that, if you looked at the actual raw data, what we saw was that when people finished the program, their symptoms fell within a normative range. So you actually can't be better than better, right? So based on that study, we would sort of conclude from that there wasn't really much point in doing two things at exactly the same time. But I think in clinical practice, and I'm sure you'd agree, I think what we tend to find is that most patients respond the best to a multidisciplinary approach. You know, often they're taking different medications if they need to. For example, they might need a laxative or an antidiarrheal. It might be that they also need to have some sort of follow some sort of dietary manipulation, but that they also might respond really nicely to the hypnotherapy. And in fact, it's a combination of all of these things that they respond the best to. But
yeah, absolutely agree.
Yeah. I digress though. The second part of that question was how best do you implement the NERVA hypnotherapy program? And I think you're right. There's no real perfect time of the day. I think it depends on what is going to fit perfectly within that individual's lifestyle. So if that means that they listen to it in the morning, great. If it's of an evening, fine. What we want is for them to be in a relaxed state. So we obviously want them to be somewhere where they can relax. It doesn't have to be completely quiet. And, you know, often, you know, my patients get worried that they're not in a completely silent space. But I often remind them that we did these research trials with Monash University at the Alfred Hospital, and I'm sure everybody spent a bit of time in a hospital, and these are not quiet environments. You know, there's Met calls coming over in the middle of a session or whatever it might be, and these people still responded, you know, to the 70-75% improvement in their symptoms. So quiet is good, but it doesn't have to be deadly silent. Otherwise, I don't think you can really do it. You know, you can do it wrong. If you've got a nice space where you feel comfortable, you found a time of day where you can sort of check out for 15-20 minutes and do the educational material, listen to the hypnotherapy recording, then you should be fine. Awesome. The other thing I was just going to mention, we were talking a little bit about research before in the context of face-to-face settings, and obviously all of the stuff that we've done with Monash has been in face-to-face settings, all the stuff that's been done in the UK, in the US, face-to-face. But we have also looked at some retrospective data from NERVA, which has been published at several and presented at several gastroenterology conferences. And what we've found is that actually the way that we deliver the hypnotherapy through the app is just as effective as if you were receiving it face-to-face. So I think sometimes that's a little bit of a concern too. You know, it's not necessarily always what time of the day or in what environment, but the question is also whether, you know, if I do this over an app, am I going to see as much benefit as what I would if I saw somebody in person? And the very early answer to that question is yes, we would expect that you would see really similar rates of efficacy via doing the gut-directed hypnotherapy over an app like NERVA versus if you came and saw a clinician face-to-face.
I think that is so awesome, and I love the fact that NERVA does collect data from their patients and they openly publish it as well to help show people why NERVA and using an app rather than seeing someone face to face, which we know is not always possible, can be just as beneficial. So I know there are so many benefits to using NERVA in comparison to seeing someone face to face for that gut-directed hypnotherapy, but could you outline a few of those benefits for the audience?
Okay, so I think the biggest barrier, I suppose, to people accessing gut-directed hypnotherapy is exactly that, is being able to access the therapy, is having a practitioner or a clinician that is available to you in a reasonable, you know, in a reasonable sort of space in terms of how far you can travel, because remembering that you're going to engage in this process for a number of weeks. And first of all, there's just not really many people that are trained in this space. There's a lot of people who are hypnotherapists, but you really need to be mindful that the person that the patient would see is somebody who is not only a hypnotherapist, but is also really thoroughly versed in terms of the gastroenterology or the intestinal complaint that they have. So whether that's a functional gut disorder, whether that's an inflammatory bowel disorder, or whatever it might be. And so something like Nerva makes a therapy that is usually otherwise inaccessible, accessible, and accessible in a manner that would provide exactly the same rates of efficacy as if that person were to do it in a face-to-face setting. I think the next barrier is cost. It's really expensive to see somebody face-to-face for a number of sessions. And obviously people, I'm afraid, have to pay for the Nerva wrap, but it's at a really significantly reduced cost than if you saw somebody in a face-to-face setting. And so again, that aids in this accessibility. The other thing is there's really no side effect to the hypnotherapy. You know, for example, if somebody were to take medication, it's very possible that they would have a side effect associated with that. Or if we manipulate people's diets, it's very possible that their diet becomes nutritionally inadequate. Now, obviously, hopefully they're working with a really amazing dietitian so that that doesn't happen. But it's not uncommon for us to see patients present to clinic who are in fact are not meeting their daily nutritional requirements. But there's no real side effect to the hypnotherapy other than it not working, which, we have to be honest, happens in, 20% of people, give or take. But that's the only thing that can really go wrong, is that you don't respond. But you have those same rates of non-response when you do a diet, and even greater rates of non-response when you take a drug. So I think that it's a really safe, highly efficacious way of accessing gut-directed hypnotherapy via something like Nerva at a significantly reduced cost in comparison to what you would pay in a face-to-face setting.
Excellent. There's so many benefits to it, like you were talking about, the accessibility, that you can fit it into your schedule. You're in the comfort of your own home, or potentially in a hospital where it is a little bit more noisy. And then there is that cost-saving benefit of doing it through the Nerva app as well. I'd love to know how long someone might be doing the program for before they can expect to see a result from completing, I guess, part or the full duration of the program.
Good question. So nobody does one session of hypnotherapy and is cured. And if that happens, then that's very, very rare and unusual. What we typically see is that people take a number of weeks to respond. And usually by the time they get to that sort of 4 to 6 weeks of engaging in the therapy, we see the greatest degrees of response. So usually in those sort of first few weeks, we don't see too much change at all. But by the time the patient sort of gets to that 4 weeks, that's sort of when we typically see that people start to report improvements. And by the time they get to that sort of 6-week point, we would expect that they would be, we would hope that they'd be doing pretty well at that stage. They might not have achieved the full effect of the treatment. And it also depends on whether they're doing other things at the same time. For example, in a clinical setting, it might not be unusual that somebody's doing hypnotherapy while undergoing a FODMAP liberalization process, in which case it might take them a little bit longer to see the full effect of the hypnotherapy if they're sort of playing around with their diet at the same time. But anywhere between that sort of 4 to 6 week time period is sort of where we would typically expect somebody to respond. We also know that if people haven't responded at 6 weeks, they're unlikely to respond. So that's also where we draw a little bit of a line in the sand. It's okay if they haven't responded up until that point. We don't get worried at 5 weeks or 5.5 weeks. But if we get to the end of that 6 week time period and we haven't seen any change whatsoever, we know that people are unlikely to respond past that point. So like I said, we usually draw a line in the sand there.
Okay, that's excellent to know. I've got a question about, I guess, compliance then to something like gut-directed hypnotherapy or the Nerva program. Obviously, we would love people to log in every single day when they get that notification come up on their phone, complete that session. But what if people were to complete it every second or third day? Does that mean that we would just expect it might be 8 to 10 weeks or 12 weeks if they see that symptom improvement? Or do you think that they could still get the benefit close to the 4-week period? I don't know if there's any research that has looked at this.
Yeah. It's a really difficult question to answer. And I suppose when we're doing clinical trials, one of the criteria that people have to meet is that they have to be compliant in order to meet the requirements of the study. So the data that we analyse is from patients who are compliant. So obviously we want people to try and comply as much as they can in order to get the full effect of the program. But let's be real, right? Every now and again we have something that comes up and it's not at the forefront of our mind to do a hypnotherapy session, as an example. And so, you know, there's a little bit of leeway. If you forget a day here or there, it's not the end of the world. But typically people who do comply, if you like, respond faster. So I always tell my patients, you know, if you listen to the recordings every day, you're more likely to respond at a faster rate than what you do if you don't listen every day. So it's not the end of the world if you don't, but if you'd like to, you know, expedite your degree of improvement, try and listen every day.
Of course, that's very encouraging. Thank you for sharing that with us. I'd love to ask you quickly about any research that you're participating in or that you're taking out at the moment. Is there anything that you're involved with at the moment? What should we keep our eyes peeled for in the future?
So there's always lots of different research projects going on in the background. One that you might be interested in is one that we are doing with NERVA. It's a randomised controlled trial between NERVA and Monash University looking at the rates of efficacy of the app. So I mentioned to you before some retrospective data that we've done. And for those people who aren't aware, essentially retrospective data is that when we collect data from our users all of the time, and then at certain points in time we decide, all right, we're going to have a look over that data and see how people have gone. So we retrospectively pull that data and analyse it. Now that's really useful, but it's not very controlled. You know, like we as researchers like to have control over our study population so that we can be really sure that what we're seeing is accountable from what we're doing as opposed to other things. And so even though the retrospective data is hugely encouraging, what we want to do now is a randomised control trial where we as researchers control everything, so that we can get a really good indication of exactly the way that NERVA is working, with an adequate control. So we're not just analysing how people are going in the program itself, but we're analysing how people are going within the program itself compared to something else that we expect would also have an effect. And so we sort of want to see that people are going to respond the way that we would expect them to respond, and that the results are within the realm of what we would expect. So that's coming, but don't hold your breath. Research takes a long time, and it will be a little while before those results are ready to share, I'm afraid.
Okay, excellent. Well, we'll stay tuned. Thank you so much for sharing that with us. My final question is, this is going to be for someone that has recently been diagnosed, or they may be about to get diagnosed with IBS. What is your one piece of advice for them?
I think my one piece of advice is take a big deep breath and then surround yourself with a team. I think the patients who respond the best are those that have a really supportive medical team. So they have their GP, they have their gastroenterologist, they have their psychologist, their hypnotherapist, their dietitian, their pelvic floor physiotherapist, which sounds totally overwhelming, right? But to begin with, you only need one or two of those people, and over time you build your team. But I think that the best piece of advice I can give somebody is to engage in a multidisciplinary approach, not be afraid to utilise things that seem a little unusual, like utilising a therapy like NERVA over, you know, an app as opposed to face-to-face treatment. And asking lots and lots of questions of all of those people. So asking lots of questions of the NERVA people, asking lots of questions of me, and really being engaged and having a thorough understanding of what it means to have irritable bowel.
Absolutely. Such valuable advice, and it's really going to put someone and give them the best chance at managing their symptoms as quickly as possible. We know that the average time between someone having symptoms and actually getting diagnosed is 6.5 years. So you really don't want to waste any more time going around in circles. I guess start finding that team and starting with 1 or 2 clinicians, like Simone had said, that are going to build that foundation, and then they can even refer you to other people that can complement that team specific to your, I guess, symptoms that you're experiencing. Simone, thank you so much for joining me on this live. You've been such a wealth of information. I'd love to honor your time and say goodbye, and hope that you have a fantastic day and rest of the week. Is there anything else that you wanted to share before you jump off?
No, I don't think so. I just wanted to say thank you. Thanks for the opportunity to talk about gut-directed hypnotherapy, and yeah, I appreciate your time.
Excellent. Thank you so much for joining me, Simone. It's so lovely to have a chat with you. Enjoy the rest of your day.
You're welcome. Bye.
Take care. Bye-bye. Excellent. So thank you so much for joining me on today's training, which has been all about IBS and gut-directed hypnotherapy. I have something really exciting to announce now to round off IBS Awareness Month. I have now partnered up with Nerva to bring you a giveaway. So if you're interested in learning more about gut-directed hypnotherapy and if the Nerva program could be suitable for you, I want you to head to my page, because I'm giving away, in partnership with Nerva, 3 12-month subscriptions to their program. All you need to do is like the post, follow, of course, my account, which I think that you're already following if you're here, and follow the Nerva IBS account as well, and tag someone that would benefit from the Nerva gut-directed hypnotherapy program. I'll be posting this a little bit later on today, so if you wanted to catch the replay, then feel free to stop, start, rewind, grab your pen and paper, write it all down, and don't forget to participate in that giveaway. It's only open for 5 days to close off IBS Awareness Month. Thank you so much to everyone that has joined. I hope that you enjoy the rest of your day.